but it also attacks the immune system. And we know when your immune system is compromised, we know how devastating that can be. For COVID-19, there were people who got the jabs. There were those who didn't get the required, who didn't go the rounds. Now, if is taking the jab, COVID-19 jab, sufficient, or does it even address it? Does it give you any form of protection?
Well, it's a good question, and it doesn't, because the viruses are biologically distinct. They are not the same types. So there's no cross protection between COVID, vaccine, with the HMPV. So that's one. Then secondly, as they say, it's an old virus, but it's standalone to some extent. It's not related to some of the other, viruses that are causing, influenza or influenza-like diseases. So even the seasonal vaccination against the seasonal flu might not protect you from HMPV. So there's no, specific vaccine yet. But so what is so important is the health education, protecting, empowering the communities to protect themselves.
Yet you said we should not be worried.
Yes. No. Yeah.
I mean.
No. Yeah. We should not be worried that it could cause a pandemic like COVID, but we should be worried that it can actually come in and destabilize the system, and even though it doesn't kill as many as COVID does, but it can increase our disease burden and create pressure on our health system. We shall get overwhelmed visits by patients to our hospitals that are already weak. They're already overpressured. So then we can also have confusion caused by the virus in people that are already immune compromised, like the HIV/AIDS. This is unfortunately, even though we have less than 1.5 million people with HIV now undergoing treatment and so on and so forth, or positive, it's a huge number. So if the virus comes and then it gives a co-infection with people with HIV, they're already immune compromised to some extent, so death rate will be higher among them. But another thing that we are worried about is that in areas where it has affected, affected in China, some of the genic processes that the virus is showing is that it might be also killing or devastating the same type of age groups, that especially more of the young ones, as has been mentioned by the Minister of Health, children below 5, and then that the burden of malaria is higher among that group. Exactly. Am I right?
Yes. Yeah.
So if it comes and any child has a malaria just like that, and this virus comes, it can be devastating. Then also, the elderly people, we know what COVID did. I have a friend who has a clinic in Kano, and during the COVID, he showed me his case note. I was shocked. He lost 72% or 73% of his patients older than 72 years. So we hope this one doesn't have that type of capability. It's not that we are causing, we are panicking all this, but we need to be prepared, as the DG said, with all these weapons.
Still talking about preparedness, I asked you earlier about the symptoms, how HMPV presents, because it's a respiratory infection. Is it similar to other respiratory infections, just so that it is easily detected? It's not confused to be, say something else. And treatment, of course, when there's a delay in treatment, it could lead to further complications. Let us know. Is it easily diagnosed? Is it clear to know this is HMPV?
It's not easy clinically. It's not possible to distinguish it from others, clinically, because it gives the same symptoms. But like the common flu. The common flu is usually affecting mostly the upper respiratory tract. So the symptoms will be, sneezing, coughing, and irritation of the throat, irritation of the running nose, and so these are and fever, of course. So it's not quite severe, but it can be very worrying and disturbing, the patient, especially those who live in the temperate areas. But this virus also has the capability to affect the the lower respiratory tract. So it can lead to pneumonia, difficulty in breathing, and that will require, intensive care and so on and so forth. So with this property, the virus is mild. It's not as severe as the COVID. But we fear now is that we hope it wouldn't also change to become as severe as the COVID virus. So that's why all the other countries are, what the WHO is saying, is now an outbreak. It's not yet given any alarm, for concern, or signs for concern, but that we should be on guards, our guards. Anything can happen. It can surprise us, and I'm happy that the DG has mentioned that to some extent, and we are very ready. But I believe that the government should empower, the health system with extra, budgetary support, because we didn't plan for HMPV before. We are planning for COVID resurgence. We are planning for other diseases that are already affecting us, Lassa fever, etc. Then this is a new without additional financial and material support, we might be taken by surprise.
Are you saying the budget for this year is not going to be sufficient? We have 4.84. That's
yeah, but the budget did not take into consideration this possibility that this
new emergence
will come. Imagine and reimagine will come. So if you don't, address it seriously, for instance, there are no specific drugs against HMPV, but there are drugs that you can use to mitigate the impact of the disease on human body. Okay, so if in the budget the Ministry of Health will submit, NCDC will submit, all the health facilities will submit, they will be based on the ones that we already know, the one we're battling with, and maybe put some 10% contingency that this could happen. But if this one becomes very serious, it can devastate and destabilize the health system, and that's why we don't want to be sitting and allow it to happen. When it happens, before you know where you are, it goes beyond health system. It even affects the economic system. It affects everything. But we know for now there's no need that there will be travel restrictions. There's no evidence for that yet. There's no need that there will be this sit-at-home, social distancing in such a severe distance, and then wearing masks and outdoor. All these are not yet. We are not yet there. But countries where this is happening, like and India and all this thing, they are now taking measures that the possibility of imposing this within limited communities where the virus is already spreading.
Shouldn't we